Hello friends, welcome back to my another video. In today's video we are going to talk about the nursing process. In nursing process we have three types of sequential steps, then caring plans, and then importance of it, then definitions of it. We will learn one by one this all, okay? So first we will start the nursing process. Before we start, I have to tell you that and inform you that in previous classes we have covered that neurological disorders or full book we have covered. And in that book we have covered Alzheimer disease, magnetic seizure, central nervous system, primary nervous system, and traumatic brain injury, fibromyalgia, brain, Glasgow coma scale, Babinski reflex, and multiple sclerosis. This all we have done within that book, and we have completed that whole book with our videos. And now this is our new book, which is Medicapedia. In this we are going to talk about the second topic, the nursing process, because we have already made one video on the first topic, means first unit, and this is the second unit, the nursing process. So you can go and watch my that video, and also you can learn about them also. So now the nursing process, the nursing process. So what is this? What is nursing process? Nursing process is the 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 nurses allow allows to give an deliberative deliberative and etiologic and maintained care to the patient needs. Now, what is the meaning of this definition? Means the nurses are the caretakers of the patient, and they knows the needs of the patients, and they give and deliberative etiology and maintains care to the patient needs. So this is the definition of our nursing process. Now, what are the importance of it? Importance of it. Basically, you know that nurses gives treatments. Nurses take care about the patient when the doctor is not there, and they give medicines to them, and they talk to them, and they make them feel like an they make feel like an their own something. They make the patients feel like they are the nurse is his own patient, or his own relatives, or like that. And they give a kind and lovely care to the patients when the doctor is not there. Now, what are the importance of it? The importance of it are like the nurses are allowed to know the needs in the disciplined way. And second one, the nurses are also use for also try to know the mutual goals of the patient. Mutual goals of the patient. Now, what is the mutual goals of the patient? Like his medicines budget, and his own disease budgets here in his hospital, and the mutual goals, like when he will how in how much years he will be, in how much months and days he will be going to get recover and cure, and more things about that, about his personal patient personals. Okay, they know in this thing. The spelling is mutual fund. Okay, mutual fund. Then third one is the nurses gives and machinatic and machineries the nurses gives and machineries and deliberative care deliberative care to the patient needs, means they give an care which is modern, means we used to use for knowing the heartbeat we used to we use stethoscope, but now in today's generation there are so many machines which connects on his same spots like on stump on heart or on neck or on hands. They used to attach on that, and after that they get to know that how much blood pressure blood pressure and heart pressure is there. Now in this generation they have invented an machine also, like and small machine which gets attached to our thumbs or our fingers on any fingers, and after that it gets starts, and after that some 1 minute or 50 or 2 to 20 seconds it gives the accurate or normal random answers, approx answers. So yeah, like of blood pressure and heartbeat. So it is also best in to know this, and he that is an hand portable, means it is a small box in which that device is there. So like this all are our machineries in our this generation which nurses use to give the best care to the patient. Now, what are the essential sequential steps in the nursing? Now I will explain you what are the sequential steps in the nursing. The sequential steps are in the nursing are first one is first one is assessment, first one is planning, then second one is evaluation, then third one is implementation, and then diagnosis, and then fifth one is experimentation. experimentation so these are the five sequential steps which nurses use. Like first they plan for the patient, what are the disease of the patient, and then they know about the cure of the patient, like they give diet and they give exercises, or they give medicines, or they give high level care like giving vaccines to them and high level tablets and all they gives. Now evaluation, what is evaluation? They get to know that what budgets the patient has, and what are the mutual goals of the patient. And then in implementation they implement the things that we of the high level care, means the high level things, the high level care, which means like if they have to give the vaccine to the patient then they gives the vaccine to the patient. And then like diagnosis means they test their diagnosis status of their certain nervous systems and brain systems, and their body status they get to know. After that they do experimentation, means they do all level cares, like giving diet to them, giving daily medicines as the doctor said, and vaccines time to time, as a week to week they gives vaccines, that like this they go if cares in the sequential steps. So these are the sequential steps which they do in nursing process. Now, what are the planned care of the nursing nurses? The planned cares of the nurses are assessment, nursing diagnosis, implementation, evaluation, planning. So these are all the thing which nurses used to do in take giving the care to the patient. Now I will say you that what the nurses gives to the patients. Firstly, we have let's summarize the things what we have done in this class. Firstly, we have learned about the definition, which was too easy, that wasn't too hard or something else. It was too easy, like the nurses give the deliberative and etiology and maintained care to the patients. Then we have learned about the importance of the nurses, like in that we have learned uh, like patient gives nurses gives the deliberative and disciplined care, and they get to know the mutual goals of the patient, and they give and modern and machinery care to the patient, and they also make them feel like they make them feel lovely and kind. When they talk to the nurses, the patient feels like they are their own persons, like relatives they feels, and the nurses makes more kind and lovely care to the patients. Now, in sequential steps, we have learned that the assessment, diagnosis, planning, implementation, evaluation. Now, we are going to learn about the care plan. What is the care plan? Firstly, the care plan is the care plan has assessment in it, assessment, the nursing diagnosis, and expected outcomes, interventions, evaluations. Now, let's talk about the assessment, diagnosis. Diagnosis I have tell, planning, sorry, planning not, expected outcomes, evaluations, interventions, interventions, and assessment. So these are the five things which they have in the nursing care plan. Now I will tell you about the assessment. What does they do in assessment? They get to know the subjective and objective data. Subjective mean they get to know about the medicines of the patient, diets of the patient, and the curable things of the patient. Then objective means they know about the diseases and what is going on in his body, the patient bodies, and what is the status, what is the blood pressure, and had blood pressure, and heartbeat, heart pressure, what is that. So they know in this assessments. Then after that, in nursing diagnosis, they have included the labels and etiology, and define characteristics of patients, like what does patient do, how when the disease has started, and how much symptoms are there, and how much are not there, and what is the disease, and how what diet does the patient takes, and when the patient eats the foods, like this. Then expected outcomes means they get to know the short term and long term goals of the patients. Short term means what the that service from the hospital is going to be short term or long term, they get to know. And interventions in the caring plan is listing the independent and collaborative interventions. So these are the thing which we do in interventions. Now evaluation, you guys see in that the in our sequential steps, evaluation is different. But in this, evaluation means that they expected outcome, present evidence of the evaluation that supports the outcome. Means the expected outcome means it is an evidence for the supports the outcome, means main outcome, means what have to done with the patient. They give an evidence to the doctors and nurses. So like this the nursing process works. And column care plan we have learned. So column care plan also works like this. So now I hope you understand what is the nursing process. And if you understand, thanks for watching my video. Bye bye.